Hi guys, this is the first of two videos in which we will look at the cardiovascular and respiratory systems. The key knowledge and key skills are listed here. Cardiovascular and respiratory systems including the structure and the function of the heart and lungs, and that includes the blood vessels and blood flow around the body and at rest, and that's included in this video. And the second video is the structure and function of the lungs and the mechanics of breathing and gaseous exchange. A key skill is to be able to perform and measure and report on changes to the cardiovascular system and respiratory system at rest compared to exercise. So we'll investigate that a little bit in this video and also during your practical lesson. So the purpose of the cardiorespiratory system is the supply of oxygen and fuel around to the muscles. The cardiovascular system includes the heart, blood vessels, and also the blood. The heart has four different chambers. The two upper chambers here are called the right atrium and the left atrium, and the lower chambers are called the right ventricle and the left ventricle. Now that looks a little bit strange because the left and the right are swapped. That's because we're looking at the heart from front on, but when we talk about the left ventricle and the right ventricle, it's as if we were, it was our heart in our body facing the front, so it's flipped over in this diagram. Some other key things in the heart are the aorta, which is a major artery up the top here. We also have where the blood enters the heart, which is called the inferior and superior vena cava. We've got some valves which are quite important as well: the tricuspid valve, the bicuspid valve, and the aortic valve, and the pulmonary valve. And then we've also got the pulmonary artery and the pulmonary vein, which is down here. Heart rate is how we measure the heart and how many times it beats per minute. Now we're going to get the heart rate monitors out in our practical classes, but what you'll find is there's a number of things which affect a person's heart rate. Exercise is a major one. As soon as you start to exercise, your heart rate will increase. Things like smoking and stress and lack of sleep can also affect the heart rate. Drugs such as caffeine will increase someone's heart rate as well, and there's also drugs that can slow people's heart down. Eating, because when you start to eat, your body needs to digest the food, so the heart rate increases slightly. Fear and excitement can also change heart rate, and also temperature changes, so environmental factors. So how do we measure what the heart can actually output? There's a couple of words that we use. The first one is stroke volume. So that's how much blood is pumped by the heart per beat. And then cardiac output. So that's sort of how hard the heart is working. So that's stroke volume times heart rate. So it's like those two things combined. So how hard is the heart working each minute? Now, like we said at the start, some of the key skills is for you to be able to identify the differences at rest and at exercise. So in an untrained person, when they're at rest, their stroke volume is 80 milliliters per beat, and cardiac output is 4.8 liters per minute. And when they get to their maximum exercise, they go up to 115 milliliters per beat for stroke volume, and for cardiac output up to 20 liters per minute. What you'll find in people who are trained and also highly trained endurance athletes is that they're able to use their heart more efficiently to pump more blood around the body. And obviously the benefit of that is that they can get more fuel to their muscles and also more oxygen to their muscles, and also remove the carbon dioxide from their muscles, so that they can work more effectively. So people who have stronger hearts, have trained their heart, have a higher stroke volume, they can pump out more blood per beat, and then they can also pump out more blood around their body per minute, their cardiac output. So what's in the blood? that one. The functions of the blood are similar to the heart, I suppose, in that the goal of the blood is to transport things around the body. So things like oxygen and also carbon dioxide. So when we breathe out, we remove that carbon dioxide. Fuel, so the glucose that's floating around in your blood so that it can go to muscles, and also numerous minerals which float around in the bloodstream as well. And it also has a major role in protecting against infection and also dehydration. The composition of the blood. So blood has about 45%, just under half, is made up of blood cells, and the other half, just over a half, 55%, is plasma. Most of the plasma is water, about 90% of it. And then in the part which is the blood cells, we've got red blood cells. And that makes up the majority of the blood cells. We've got white blood cells, so you can see the white ones here, and those are the blood cells that protect us against infection. And we've also got these things called platelets, which if you get a cut or a graze, they will actually help you to form a scab, create a bit of a blockage, and that allows your injury to heal. There are people that are called haemophiliacs who don't have if only a few platelets in their blood, and that means that when they get a cut or a graze, that they really struggle to stop the bleeding. So it's quite a serious condition. We've got the arterial blood vessels going around the body, and the venous blood vessels, so the veins in the body. And you'll see here in particular the colour, so we've got red and blue, and the red indicates that the blood has oxygen in it, so that's oxygenated blood, whereas the blue is deoxygenated, so it doesn't have as much oxygen in it. That gives it its red colour. Just another diagram here, the arteries, which take blood away from the heart, and again they're red, so most of the time they are fully oxygenated and they carry oxygen around the body, and they're quite strong and thick. You can see they have to pump the blood from the heart and squeeze it around the body, so they've got a big job to do. Then when the blood gets to our muscles, we have things called capillaries, which are these small ones here, and the capillaries are really, really tiny, and that allows for the blood to diffuse and jump across into the muscles. And then on the way back, the blood comes back through the veins, which are not as muscular as the arteries because they don't have as much pressure trying to pump things around the body. So, as I said, the arteries carry blood away from the heart, and the veins return the blood to the heart. Capillaries connect the smaller arterioles, like smaller arteries, and smaller veins or venules, and they're the smallest blood vessel. So there's quite a good diagram down here, so you can see that the blood comes in, the oxygenated blood comes in from the arteries, it goes to the smaller arterioles and then to the capillaries, and that's the point where it diffuses into the muscles, and then the blood passes back out, generally with a higher concentration of carbon dioxide as a wastage byproduct, through the venules and then into the veins. So again, another effect of exercise on blood flow. So when we're at rest, our muscles are using up about 20% of the blood that's floating around. You can see our heart uses a small percentage as well. The skin, the brain, the digestive system is quite significant at rest. So when you're at rest, you're digesting food, and that's where a lot of the blood, over 50% of the blood, is around your digestive system. When you then switch that to vigorous exercise, so a really hard run or something like that, some sort of vigorous exercise, most of the blood, about 85%, goes to the muscles to keep them working, keep them oxygenated, and remove the carbon dioxide that's the byproduct from the muscles. And significantly less goes through the digestive system. That's why if you do have a big meal and then you try and do heavy exercise, you can often feel quite lethargic because the body's struggling to get that blood from the digestive system to the muscles. In terms of circulation of the blood throughout the body, we divide it into two. So we've got systemic circulation and pulmonary circulation. Now, systemic circulation is from the heart to the body, so that's this one down here. So the blood gets pumped from the heart all around the body, through the arteries, through the capillaries, and then back through the veins, and then it comes back to the heart. Pulmonary circulation is to do with the blood going to and from the lungs. So it obviously needs to get oxygen and get rid of the carbon dioxide. And so the blood goes through the heart and then comes up through the pulmonary system into the lungs. Then the oxygen comes in, attaches to little things in the blood, and then that comes back around through to the heart. You might have done a blood pressure test before. If you've been to the doctors, they often do this one. So blood pressure is to do with how much pressure your arteries are exerting against the blood vessel walls. So the higher that is your blood pressure, the harder the heart is having to work to pump blood around the body. So people with high blood pressure, their heart is having to work a lot harder to pump that blood around the body. Generally, a good blood pressure reading is around 120 over 80. So we're just going to talk a little bit about how the blood flows through the heart. So the first stage is where the atria of the heart fill. So they're the top two chambers, and because of the pressure build-up from that, the mitral and the tricuspid valves open, and the blood then flows downwards towards the ventricles. The valves shut off so that there's no blood flow back up through the ventricles into the atria. The blood then goes into the ventricles, and the aortic and pulmonary valves open, and the ventricles, which are a bit more muscular, contract, and they force the blood into the aorta so it can go either round to the rest of the body or into the pulmonary artery to go off to the lungs. So it's quite a good diagram here. So the blood comes in from the inferior vena cava or the superior vena cava, which is at the top, so that comes from the top of the body, into the right atrium here, and then that pressure builds up. This valve here, tricuspid valve, opens. The blood will flow down into the right ventricle, and the right ventricle will then fill up, and then it pushes the blood out into the pulmonary artery to either the left lung or to the right lung. The blood then comes back from the lungs, and you can see now that it's red, so it's got oxygen. The blood comes into the left atrium. Again, this chamber fills up with blood, the pressure builds up, and it goes down into the left ventricle, and through the aortic valve, through the aorta, which is your major artery, and then it flows off towards the body. So it either goes to the upper body or down to the lower body, and that the blood then flows around the body and comes back in to the superior and inferior vena cava. This is just another good diagram which indicates the flow of blood through the heart. So pretend that this house is kind of like the heart. The valves are quite important, so they are kind of like these doors that open out, and then once this chamber is filled up, they slam shut, and that means that no blood can flow back through the heart. We don't want that to happen. There needs to be a continuous flow of blood going through the heart into the lungs, back to the heart and around the body. So those valves are quite important in shutting that off. Okay, now we're going to go to a task in a minute, but before you go to that task, just pause on this page and just type in some of these websites, have a bit of a go at some of the activities or questions in that. There's some good interactives which show you how the blood flows around the body and through the heart. And then once you've finished that, your task for this lesson will be to create a poster of the heart, and we're going to put these up in your classroom. Your heart poster needs to label the following: needs to have the superior and inferior vena cavas, It needs to show the aorta, it needs to clearly show the left and right atria and left and right ventricles, the tricuspid and mitral valves, the septum, the pulmonary artery and pulmonary vein, and your poster must also indicate the direction of blood flow around the heart, lungs and the body, and also whether the blood is oxygenated or deoxygenated. So you're going to have to work out a way of showing that as well. Okay, good luck.